Hello and welcome everyone to today's informative session. We're going to delve deep into a common, yet often misunderstood health condition, sinusitis, also known as sinus disease. This condition is more prevalent than you might think, affecting millions of people worldwide every year. Understanding sinusitis can not only help alleviate discomfort for those who suffer from it, but also aid in early detection and prevention. Today, we'll be exploring this condition in a simple and straightforward manner, from its inception to its possible complications. We will discuss the common symptoms associated with sinusitis, how it can be diagnosed, and the various treatment options available. Furthermore, we'll also touch upon how you can potentially prevent this condition and the complications that may arise if left untreated. So, get ready to equip yourself with knowledge that could make a significant difference to you or your loved one's health. Stick around to learn about sinusitis, its symptoms, diagnosis, treatment, and how you can prevent it. So, what exactly is sinusitis? It's a common ailment, but do we really know what it means? Well, let's break it down. Sinusitis, as the name suggests, is all about our sinuses. These are small, air-filled cavities located within the bones of our face and skull. They're positioned around our nose, eyes, and cheeks, and their main job is to produce mucus. This mucus keeps our noses moist and helps to filter out dust, pollutants, and microorganisms. But what happens when things go wrong? When the sinuses become blocked, or the mucus can't drain properly, problems arise. This is when we talk about sinusitis. Sinusitis is an inflammation or swelling of the tissue lining the sinuses. When they become blocked and filled with fluid, germs can grow and cause an infection. There are two main types of sinusitis. Acute sinusitis typically starts with cold-like symptoms, such as a runny, stuffy nose and facial pain. It may start suddenly and last 2 to 4 weeks. On the other hand, chronic sinusitis is a more enduring condition, with symptoms persisting or recurring for more than 12 weeks, despite medical treatment. It's important to note that anyone can develop sinusitis. Whether you're an avid runner or a cozy homebody, young or old, everyone's sinuses can become inflamed. Factors such as allergies, nasal polyps, a deviated septum, or common cold can increase your risk. So why should we care about sinusitis? Well, besides causing discomfort and potential pain, untreated sinusitis can lead to serious complications. These might include abscesses, meningitis, or a spread of infection to the surrounding bones. But don't worry too much. Sinusitis is treatable, and most people recover completely with appropriate medical intervention. The key is to recognize the symptoms early and seek professional help. Now that we know what sinusitis is, let's dive into how we can identify it. Identifying sinusitis is the first step towards treating it. So, what are the signs we should look out for? Sinusitis, often referred to as sinus infection, manifests in a variety of symptoms. First and foremost, individuals may experience pain, swelling, and tenderness around the cheeks, eyes, and forehead. This discomfort is often accompanied by a blocked nose, making breathing difficult. The blockage can also lead to a reduced sense of smell. Another common symptom is a high temperature, or what we often call a fever. This might be coupled with headaches, toothache, and bad breath. Some people with sinusitis also complain of fatigue and a feeling of pressure in their head. If you've been having these symptoms for over a week, or they seem to be getting worse, it's time to seek medical help. But how do doctors diagnose sinusitis? Well, your doctor will start by asking about your symptoms and medical history. They may also carry out a physical examination, which might involve looking into your nose with a light source. If the symptoms persist for more than 12 weeks or keep returning, you may be suffering from chronic sinusitis. In such cases, your doctor may recommend additional tests to confirm the diagnosis. These could include a nasal endoscopy, where a thin tube with a light at the end is inserted into your nose. This allows the doctor to check for any abnormalities in your sinuses. Other diagnostic tests could involve imaging studies, such as a CT or MRI scan, to get a detailed view of your sinuses and check for any deeper issues. In rare cases, a tissue or mucus sample may be taken to rule out other conditions like nasal polyps or allergies. Remember, sinusitis can affect anyone, from children to the elderly. So it's crucial to be aware of these symptoms and seek professional help when needed. Armed with knowledge about its symptoms and diagnosis, let's now uncover the treatment options for sinusitis. While sinusitis may seem daunting, there are various treatment options available. The treatment for sinusitis generally depends on the severity and duration of the symptoms. If you're facing acute sinusitis, which typically lasts less than 4 weeks, over-the-counter medications, saline nasal spray, or nasal corticosteroids may be recommended to alleviate symptoms. For chronic sinusitis, which lasts more than 12 weeks, your healthcare provider might prescribe antibiotics or oral corticosteroids. In some cases, your doctor might recommend immunotherapy, where allergy shots are used to reduce the body's reaction to specific allergens, especially if allergies are contributing to your sinusitis. In more severe cases, when medical treatment doesn't seem to bring relief, surgery may be recommended. Endoscopic sinus surgery, for instance, involves a doctor using a thin, flexible tube with a lighted end, called an endoscope, to remove polyps or other obstructions that may be causing the sinusitis. Now let's move on to prevention. In order to avoid sinusitis, it's crucial to keep your sinuses healthy. Regularly washing your hands, avoiding smoking and secondhand smoke, and staying clear of allergens can significantly reduce the risk of developing sinusitis. Using a humidifier to moisten your home's air can also be beneficial, but remember to keep it clean to avoid bacteria or mold buildup. Staying hydrated and using a nasal saline spray can keep your nasal passages moist and thus more resistant to inflammation. Regular exercise and a balanced diet can also boost your immune system, helping you fight off infections more effectively. Maintaining good health habits is essential in preventing sinusitis. However, it's also worth noting that some cases are caused by structural issues in the sinuses, which may require medical intervention. Treatment and prevention are key, but being aware of potential complications is equally important. So while we can take measures to treat and prevent sinusitis, it's vital to stay vigilant and consult a healthcare provider if symptoms persist or worsen over time. Sinusitis, if not treated properly, can lead to some serious complications. And that's what we're going to delve into now. The complications of untreated or chronic sinusitis are not to be taken lightly. Over time, the inflammation and infection can spread to nearby areas, leading to more severe health issues. In some rare cases, sinusitis can cause meningitis, an inflammation of the membrane surrounding the brain and spinal cord. This is a serious condition that requires immediate medical attention and can be life-threatening. Another potential complication is an abscess, a pocket of pus that can develop in the sinuses or even in the brain. This also requires immediate medical intervention. In addition, chronic sinusitis can lead to a condition called osteomyelitis, which is an infection that can spread to the bones in your face. Sinusitis can also affect your eyes, leading to a condition known as orbital cellulitis. This can cause eye pain, swelling, and sometimes even loss of vision. And for those of you who love to breathe freely, untreated sinusitis can result in a deviated septum, which can make breathing more difficult. But it's not all doom and gloom. The good news is that these complications are rare, and the majority of people with sinusitis recover completely with the right treatment. That's why it's so important to seek medical advice if you're experiencing persistent sinus symptoms. Don't ignore your body when it's telling you something is wrong. And now, we've reached the end of our journey through the world of sinusitis. We've covered the basics, the symptoms, diagnosis, treatment, prevention, and now, the complications. With the knowledge shared today, you're now equipped to better understand, identify, and seek treatment for sinusitis. Remember, health is wealth, and knowledge about our health is the first step towards wellness. Thank you for joining us today.